Hello, David. Can you tell me, what is the Quartz trial? What are you trying to find out, and how might people benefit from taking part?
So the Quartz lung trial is adding radiotherapy to the chest, to the standard care that people are getting when they've got stage 4 lung cancer. It's a group of patients who either are not having treatment with drugs, so for example, not having chemotherapy or immunotherapy, or have completed treatment with drugs. And what we're trying to find out is whether adding radiotherapy to the chest helps patients, whether it, for example, helps prevent symptoms from lung cancer arising, whether it helps quality of life, and whether it potentially helps people to live longer. Whichever one you get, whether you get the radiotherapy or no radiotherapy, the aim of the team that are looking after you is to keep you as well as you can, for as long as you can, to deal with any symptoms that come along. And essentially that's often led by patients saying, I've got this problem, and then the clinical team will discuss what that means for them and how they best look after them. So the underlying supportive care that people get doesn't change whether or not they get the radiotherapy or not. They're still looked after as very best can be.
Some people have told me that they don't feel very well and they're often tired and can't do much. Will it get worse if they take part in the Quartz trial and get low-dose radiotherapy? How long do you estimate it will take to recover from that?
So that's a really good question. So one of the most common side effects of radiotherapy is tiredness. For most people, that's not exhaustion, but it is just more tired than they are day to day. Probably on average, it takes about 6 weeks to recover from that. It will vary from person to person. Some people don't have tiredness as a side effect. It's not definite that people will have it, but that's probably the average duration of having the side effect if you experience it.
Why are there two choices of low-dose radiotherapy treatment, and what is the difference between them?
Yes, that's a really interesting question. So the simple answer is we don't know which one might be better, and they're probably considered similar. And your own centre will normally have chosen what they think is the right approach, whether that's a 5-treatment approach or a 2-treatment approach. The 2-treatment is a little bit more intensive for each individual treatment, so they end up being roughly equivalent in terms of the dose, but we don't really know which is the better one. They probably both work in quite similar ways.
And lastly, David, if it all gets too much, can the patient stop being part of the trial without any pushback on anybody's part?
Absolutely. So you can withdraw from the trial at any point. You don't need to give an explanation or a reason. You can just say, I don't want to continue with the trial. The team will then discuss that with you. The options are to withdraw completely from the trial, or the option sometimes is to withdraw from the trial but still allow your information to be collected, but that is whatever works for you.